I'm so excited today to interview Tash Fothergill Mizpah, who is a friend and a colleague and just an amazing person all around. She just won the Tom Isaacs Award from the Cure Parkinson's Trust and the Van Andel Institute. She's located at Newcastle University in the UK. And welcome, Tash. Congratulations on your award.
Thank you very much. It's a privilege. So I'm really excited to be this year's recipient.
So, what is this award about, and why do you think that you won it?
So the award is to recognize a researcher who's significantly impacted the lives of people with Parkinson's, and done that through participatory work with them in the research. And so I believe that my work has centered around giving a voice to people with Parkinson's and involving them in research and in engagement activities, and just giving them a voice, understanding their stories. And I think, and from my understanding, I've managed to do that, which is fantastic and a real achievement, I hope.
Absolutely. I think that you're well deserving of this award. I put you on the spot for a second, but I think that your work has been pretty amazing. You've specifically been interested in the voices of people living with Parkinson's in Africa, and perhaps you can tell us a little bit of that work. I know that you've worked with some nurses there to set up some support groups on the ground. You've really been on the ground doing a lot of advocacy work, and then also even working with the WHO around some of these sorts of ideas. So literally on the ground, sort of from a bottom up, but also on a very top down approach, which I think is really important to understand a little bit from an advocacy perspective. So tell us about that.
Yeah, so I guess the crucial bit is being on the ground, and that's what I love the most, and being able to speak to people to help them and to set up things like support groups that they can access, which was kind of based on my research as well. So my field work that I did for my PhD, and there was definitely this gap in awareness and understanding and education and support for people with Parkinson's. It just wasn't accessible through the health service, which means that there's that niche area of a support group which can support people. So I set up a group in Mombasa back in 2018, which is still running today. It's amazing, and it supports about 50 people with Parkinson's and their families. During COVID, we went virtual, so I was hosting bi-weekly online sessions and getting experts to talk about different topics, and that's where I worked with Jane and Louise, who are PD nurse specialists from Wales. And we created some top tips and translated it into Swahili, so really creating those educational resources for people in Kenya. And then, so the other end of it is the WHO work and working on a consultancy basis for the Brain Health Unit and trying to influence that kind of higher policy level. And so worked on the technical brief on PD, and also now on improving access to medicines for Parkinson's, which is a huge challenge in Africa and across the globe. So trying to understand how we can make medicines affordable and available for people with Parkinson's. And obviously through my actual day job, which is as a researcher working on a grant currently across 7 different countries in Africa, to transform the landscape of diagnosis, treatment, and care for Parkinson's. And a huge component of that is community engagement and involvement. So making sure that research is driven by people with Parkinson's, by people with lived experience, and ensuring that they're involved in the outputs of that work, and setting up groups in all those different places as well, which is very exciting.
So, what started your passion? How does somebody from Newcastle end up doing this work in Africa?
So I'm not from Newcastle. I ended up at university here, but I grew up in Kenya. So I'm Kenyan and British, and so I've always had that passion to kind of go back and help. And I've always very much identified as a Kenyan, not a Brit. But yeah, so that's why I have that passion for improving the situation.
Absolutely. For the people out there who might be watching this, who are movement disorders specialists and interested in taking care of people with Parkinson's, what are a few sort of things that shocked you about the situation? Because I know you've taught me a lot.
Yeah, we haven't really touched on the stigma yet, have we? And that's something that we're both very passionate about. And So one of the I forgot to talk about the film. So one of the outputs from my research was this significant burden of stigma, and the consequences of stigma on people with Parkinson's and their families, which could result in human rights violations, murders ultimately, at kind of one end of the spectrum, but just societal exclusion on the other. And so this stigma associated with conditions like Parkinson's, and wider neurological disorders as well it's just shocking. So earlier this year, I went out with some colleagues and we made a documentary about this stigma, which is available online. It's called Shaking Hands with the Devil, and it's a real representation of what many people with Parkinson's in the world go through and experience. It's a tearjerker, but I hope it's a call to action to do more for these communities of the world, where access to medicines is so scarce, access to specialists, movement disorders don't exist. And these attitudes towards people with Parkinson's are just, devastating.
So yeah, absolutely. Stigma is huge, not just in the African content, but for all people honestly living with Parkinson's, even in minority populations around the world, but for every person who's living with this disease. So we've written some things in that space, and we can link our papers and also the movie. And then I think also, so the access to care issue of medicines, is a really important thing to bring up. I didn't realize that there were countries in Africa in which we can't prescribe levodopa, and then when we can prescribe levodopa, the formulation is the 25 to 50 formulation, which is a really large amount of levodopa in one pill. And so sometimes people get these medicines, if they're lucky enough to have access, and then end up getting dyskinesias quite soon, you told me, and then stop.
So I mean, the first one of many barriers is that no brand or formulation generic originator is registered in a lot of countries, which means that it's actually illegal to prescribe it and to sell it. So levodopa is just not prescribable at the end of the day, but people do prescribe it, and there's ways that you can get it. It's not frequently has stock out, so it's not consistent availability. So you might have it for a couple months, and then it won't be available for another 6 months. So imagine that knowing that there's something that can improve your situation so much, and then just not being able to have it, even if it was there, and you can't necessarily afford it. And so again, maybe you could afford a week's supply, and then you have to go for months without it. So your symptoms are going to worsen. And then at the other end of the spectrum, what is available, as you say, is the 275, which then induces these dyskinesias, which are even more shocking than the actual symptoms of Parkinson's. So it's just a constant battle. And just, it really needs to change, because we know that levodopa is available and affordable in the world. It just needs to get to these people.
Thank you so much, Tash, and congratulations, Dr. Misbah, on your award. Well deserved, and yes, cheers to you.
Thank you for giving me the opportunity to talk about it with you. It's always a pleasure.